Hello, my name is Vani Da Fonseca, and I am the program founder and advocate for the specialized doula care for Black birthing people. The problem my innovative solution is combating is Black maternal mortality and morbidity. No matter your background, status, or resources, too often all people see is the color of our skin. Even Serena Williams, a world champion and global icon, nearly died in childbirth because her medical concerns were dismissed. She had to actively fight to be heard. In the United States, Black women are 3 to 4 times more likely to die during childbirth compared to their white counterparts, despite neglecting pre existing conditions. They are also more likely to experience life threatening conditions, including preeclampsia, postpartum hemorrhage, blood clots, preterm birth, and low birth weight for their babies. Additionally, Black women face medical neglect, unaddressed pain, and implicit bias that impact their quality of care. Ultimately, the foundation of modern gynecological techniques were pioneered on the enslaved Black woman without anesthesia or consent, leading to the continuous neglect of this community. Black women are dying at a rate much faster than any other racial group for no other reason than being Black. Even more concerning, 46% of these deaths are considered preventable. It is incredibly concerning for the percent to be so high, yet very little research and interventions are taking place. It is highly unethical to disregard patients based solely on their race. Additionally, these unjustifiable deaths are costly to the American healthcare system, with it costing $8.9 billion in the past 2 years. My product solution is an online community based doula training program, specifically to meet the needs of Black birthing people in high risk areas. So, what does it mean to be community based? Well, this means it's a for us, by us solution that trains and employs doulas from the same communities they serve. Those are the people who understand the culture, the challenges, and the lived experience of their clients. It builds trust, increases access, and centers support where it's needed most. The specialized training will consist of a foundational understanding of gynecology and maternal health disparities, recognition and early intervention strategies for conditions such as preeclampsia, postpartum hemorrhage, cultural competency training to ensure doulas can effectively advocate, trauma-informed care techniques to provide emotional and psychological support tailored specifically to Black birthing people. All of these factors will lead to a decreased maternal mortality and morbidity rate in the Black community. This material will be compiled on an online learning management system. An LMS is an online platform for accessible learning and training programs, fitting the needs of my program perfectly. It serves as a centralized system for creating, delivering, and tracking educational content, making it easier to manage learning experiences for the target audience. To make sure my product is successful, I will have a community centered, equity driven, and informed by lived experience model. This means engaging directly with communities in which I plan to launch the program, doulas, healthcare providers, and community organizations. Specifically, partnering with Phoenix Birth Foundation, Black Mamas Matter Alliance, and Arizona Birth Workers of Color. By co creating with those in the front lines, we ensure the program is not only culturally relevant and responsive, but also sustainable, trusted, and truly transformative. The core team will consist of me as the program director and the curriculum lead, Dr. Deshaun Taylor, a gynecologist and family medicine physician in the Valley, as a clinical advisor, Nena Okuwagu as a community engagement lead, Draylene Drummer as the policy advisor, and Angel Palazuelos as the financial lead. To ensure the continued success of the program, a series of tests will be conducted to gather metrics on what to keep versus what to change in the program. The first being a qualitative comparison study that involves a cohort of Black birthing individuals all residing within the same geographic area. There will be three groups of participants: a control group receiving no doula care, a group receiving traditional doula care, and a group supported by the doula training program through the community-based model. At the end of the experience, participants will complete a survey with the questions to validate the program, including: to what extent did you feel heard and understood by your providers? Do you feel emotionally supported? And would you recommend this program to others? The second test will be a cost analysis using hospital records and billing data, the rates of cesarean sections, NICU admissions, emergency interventions, length of hospital stay, and other unforeseen procedures will be evaluated in high-risk areas. The goal is to examine costs related to maternal care to demonstrate that the implementation of culturally relevant, competent doula care cuts costs significantly for all health institutions. The third is a knowledge test to assess whether the program adequately equips doula with the knowledge and skill sets needed to support high-risk birthing populations, better patient outcomes. And for this, a pre and post knowledge assessment will be conducted. The pre-assessment will serve as a baseline for understanding participant knowledge prior to the training. And then following the program, they will take another assessment to measure the learning gains. The fourth is to directly measure the impact of maternal health outcomes over time, with the key metrics including maternal morbidity and mortality rates, postpartum complications, child health outcomes, and patient-reported wellness measures. Data collection and analysis will occur over a 2-year period to ensure sufficient sample size and to ensure observed changes over time. The findings of these will guide an iterative improvement process, while final results will determine the program's long-term viability and scalability. My business model is based off an iterative process. We will be implemented, funded, and sustained through the Arizona Medicaid 1115 waiver program, which is a transformative project intended to advance member health and outcomes. To get this grant, I must provide a detailed proposal of the product and how it aligns with Medicare objectives. From there, it will undergo a review process on both a state and federal level for approval. Getting approval will allow Black birthing people to have specialized doula care during pregnancy, childbirth, and postpartum recovery. Continuous testing will be done to better the program and validate its effectiveness, and additional changes and customizations will occur as a result. Once I have obtained approval, the next step is to finalize the curriculum framework, making sure to partner with clinicians, nursing staffs, medical educators, and professors to ensure my program is in top shape. Then I will engage with stakeholders, being in Medicaid meetings, finding partner organizations to then go into the next step of launching or piloting the program, taking place over 2 years, excuse me. This will then be evaluated so we can revise the training program as well as the curriculum and prove that we should have permanent funding to scale up and be sustained permanently through Medicaid. Thank you so much for listening, and here are my citations.